Hi, this is Kayla McLean, and this is going to be my self-care plan presentation PowerPoint for our final for your class. This is for BSS 4900.OL2, and it is due on July 25th, 2024. I don't know how to actually add this to, make it a video, so I'm just going to add this to the PowerPoint itself, I guess. But that's besides the point. Okay. What is self-care? Self-care is a way that a person can help improve their mental, physical, and social well-being. This quote comes directly from the National Institute of Mental Health, and it was made in 2024. This type of self-care will better your health and give you a peace of mind and make you feel better about yourself and feel more relaxed and at peace. Alright, so the next slide is, who is Kayla McLean? Facts about me. My name is Kayla McLean. I am a 24-year-old female who is pursuing a bachelor's degree at NCCU in Behavioral and Social Sciences. I am a mother to a wonderful 2-year-old son named Hudson, and you can see him in the picture I have provided on this slide. I currently work for a local county social services office as an income maintenance caseworker too, but I would definitely love to actually work in a social work position once I finish my degree and I have a little bit of experience under my belt. That'd be really nice. Some of the things I enjoy are going to the beach and reading books or listening to audiobooks. I prefer audiobooks just because it's a little bit easier for me to interact with them when I'm working, because I can't really just sit there and flip a page every day. But I'm open to both. These are my self-care assessment results. My strongest areas were the physical and emotional. I believe I'm good at the physical aspect because I am active and I do go to the YMCA with my son and my husband, and we exercise quite frequently, and then I always take him to the park and just go outside and make sure we're staying physically fit. The emotional aspect, I believe I'm emotionally stable, and I do allow myself to feel what is needed in the moment. I feel all the emotions. Sometimes you just have to cry it out, and that's okay. It doesn't make you any less of a person. It makes you honestly feel more human. The weakest areas that I found in my assessment were the psychological and mental, mostly because I do suffer from strong forms of anxiety, and I did have a lot of postpartum depression when I did have my son, and I do have a little bit of health issues going on currently, but those are the reasons why that was my weakest link. What are my major stressors? So health issues was obviously my first one. As previously stated, I do have pretty bad anxiety, which I'm currently trying to get better, and it does affect my everyday life. I have started medication to help ease my mind and make me feel a little bit more normal and at ease during the day, so that I'm not worried about a lot of things that are especially out of my control. The other major stressors I had were lack of time and overload. When it comes to my workload, I do have a lot on my plate at my job. I always want to be the best at my job and make sure I'm always going to be the first person to go above and beyond and make sure, when the time comes, I'm looked at in a positive aspect to move up for a different position. But this does mean that I often have a hard time saying no. I don't want this to affect my personal life because I like coming home and still having time to see my child and play before he has to go to bed. The next slide is images of a person with anxiety and how frustrating it can feel. And then the next is just a slide of a workplace and someone working, because I do work hybrid both in the office and at home.